Welcome back to the Mountain Man Medical YouTube channel. Thanks for joining me. My name is Brian, and in this week's videos, I wanted to talk a little bit about how to get your casualty out of their clothes so that you can get eyes on the injury. This is important in emergency medicine because we want to make sure that we're treating that wound correctly. And to be able to do that, we need to be able to see the wound. And we can't see the wound if they have a lot of clothes covering it. Have you thought about how you're going to get them out of those clothes? I have. Stick around, we're going to talk about that next. In the military, they teach you to go high and tight with the tourniquet because you don't have time to see exactly where that wound is bleeding from. So if the wound is bleeding somewhere on the arm, you don't take the time to stop and find exactly where that wound is. You just apply the tourniquet as high and tight, and then you keep fighting, or you extract that casualty to a safer location to better assess the casualty and make sure that you've stopped that bleeding adequately. Now, as a civilian, you're unlikely to be in a care under fire phase, which means you should have the time to take a look at your casualty and see exactly where that bleeding is coming from. But to be able to do that, we need to be able to remove the clothes. Now, it's important that we get those casualties' clothes off, and it's important that we do it safely. If we can't do it safely, we might as well not be doing it at all. We don't want to cause greater injury to our casualty or to ourselves when we're trying to remove those clothing. So having some safe options available is a great idea, and you can use them for a variety of other things as well. But it's important that you have some sort of cutting tool near you or on you that you can use to do this safely. So here are some options and some things to think about when you are deciding whether or not you need to remove the casualty's clothes so that you can get a better inspection of that injury. So come on back, we'll take a look at that now. All right, so I have some cutting options laid out here in front of us, and I'm going to start here on the left, and this is a product from H&H Medical. This is called the Klever Kutter. And this is a seatbelt cutter. It's very cheap, very simple tool, but it is razor sharp. Next up, of course, is our trauma shears, and we sell both of these products on our website, so feel free to go check those out if you want something. These are a smaller pair, more compact, easier to carry, and these will work pretty good for you. They cut through seat belts, clothes, everything else. Nice, safe method of getting the casualty's clothes off. And the last option is probably going to be your most popular option because this is going to be an item that you're probably going to have on your person already, or you might have somebody who's standing nearby who has a pocket knife and you can borrow it from them. But ultimately, it's a good idea to always have a pocket knife on you, but when it comes to cutting clothes off of a casualty, this is not your best method. You want to go with one of these over here. Now, this will work in a pinch if it's all you have. All right, so we've got Mr. Chris Clean here. He's going to be our casualty, and we can see that he has received some penetrating trauma to the chest, but we want to make sure that we can see that wound. We also need to expose it so that we can put a chest seal on it, right? So we need to be able to get this shirt off him and at the very least see what we're dealing with. Maybe it's down here more in the armpit and we need to cover a junctional bleed. At the very least, we need to get this out of the way so we can put a chest seal. First up, we're going to use the Klever Kutter from H&H Medical. We're just going to put it in there and we're just going to strip this away. And you can see, just slowly work your way down and it cuts right out. We can expose that area, put it on, or keep cutting it all the way off if we need it to. Klever Kutter, H&H Medical. And of course the shears, I won't go over this in too much detail. I'm sure you guys already know how this all works, but essentially just rip those clothes right off. No big deal. All right, I've rolled over Mr. Chris Clean here, and we want to be able to check the back as well as the front because if there's penetrating trauma, there's the possibility that it came out the back and we need to be able to treat and take care of both wounds. So to do that, I'm going to show how we might expose the back with the good old knife. A lot of times I see people running it up like this. You run the risk of cutting them or running it this way and cutting yourself. In an emergency situation, there's a lot going on, people running everywhere. The casualty might not be sitting still. You run a pretty good risk of accidentally hurting your casualty or yourself. So using this as an option, not your best bet, but sometimes you got to make do. So if you're going to use a knife and it's all you have, how can you do it more safely? This is the best method that I've found. First thing that you want to do is you want to come up, pinch the fabric, and just cut a small hole, just like that. Carefully put the blade away And then you're just going to hook 2 fingers in there, or a thumb and a finger, and you just rip it open. Easy day. Now, say for example, you've got a hole in the casualty and you don't have any cutting tools. You don't have a knife, you don't have a Klever cutter or any trauma shears. This is one of the most efficient and best ways of exposing that wound as quickly as possible. We roll the casualty over and we see that he's got a hole right here. Obviously the bullet went through and through. All we got to do, hook our fingers in there just like we did with the knife, pull it away, and we're able to expose the wound. That's the easiest way to do it without a knife. Even if you do have a knife or shears, this is the way that I'm going to expose the wound when I have to. If it's not working for whatever reason, then I can go to my shears, but this method is the fastest, most efficient way. And it'll work for jeans as well as shirts. This works for just about every type of clothing. All right, so that's how you get a casualty out of their clothes, and so that you can visualize the wound and know exactly what it is that you're dealing with and make sure that you're treating that wound appropriately. We looked at the Klever cutter from H&H Medical, available on the mountainmanmedical.com website, along with the trauma shears. Both of these are pretty normal options. And then you also have the knife, how to use that more safely and efficiently. And then if you don't have any of these things, and the best method that I think is out there is just getting your fingers in the fabric, just rip it away. Most fabrics will just rip away like that. It doesn't require a huge amount of strength. If you have a compromise in the fabric already, it's just easy to tear it away. Don't forget to hit the like and subscribe button if you got anything out of this video today. It helps me to keep these videos coming back out to you, and it helps you to get notified when I drop a new video. So head over to mountainmanmedical.com and pick yourself up a Wind River or a Yellowstone trauma kit and be ready for whatever the mountain throws at you. I'll catch you guys in the next one.